Now let's talk about the fundal height assessment. Okay, now when we check for the fundal height, look at this image here. Okay, so we're using the ulnar border of our hand, right, to check the fundal height, and we start coming down from the Ziffy sternum. Okay, don't go the other way around in front of the examiner. And sometimes you see that the uterus is going to be tilted to the right, slightly dextro-rotated. Okay, then in that situation, to measure the fundal height, see if the uterus is slightly dextro-rotated. Okay, then you'll have to correct the dextro-rotation, align the uterus longitudinally to document on the fundal height. Otherwise, you'll get a less assessment of fundal height. Okay, so you have to align it accordingly. Okay, so with one hand, you're going to align or you correct the dextro rotation and then check the fundal height. That is what you're going to do. And it has to be the ulnar border of the hand, not poking like this or not poking any other way, ulnar border, right? And you're going to come down and then you're going to document the fundal height like this, right? So once you've documented the fundal height, right, you can mark it with the pen. So keep that in mind. Now, what you also need to know is how to document the fundal height in weeks. What does it mean, right? Like for instance, here, this is somewhere around 32 weeks in this particular image. That's because we've roughly divided the abdomen into specific areas, and you've done this in your undergraduate years also. So we're going to go for a quick revision. So fundal height assessment, you see, I mean, the uterus is a pelvic organ initially, right? And as it enlarges inside, it becomes an abdominal organ, right? So you can see here, right, that the uterus comes and becomes palpable just above the pubic symphysis at around 12 weeks of gestation. Then the area between the umbilicus and the pubic symphysis is divided roughly into two parts, right? So midway between the umbilicus and pubic symphysis is somewhere around 16 weeks, right? At the level of the umbilicus is 24 weeks, right? Now, yes, maybe a little below the umbilicus could be taken as 22, a little above the umbilicus could be taken as 26, and your estimations improve as you keep seeing these patients day in and day out in your OPDs and wards. Now, the area between the umbilicus and the Ziffy sternum right here, okay, this is the Ziffy sternum. The area between the umbilicus and Ziffy sternum is divided into 3 equal parts, right? If you go back to the previous image here, right? So this is the umbilicus and this is the Ziffy sternum where I'm starting. So this will be divided into 3 equal parts, part 1, part 2, part 3, like that. So all the way up to the Ziffy sternum, and then this is divided into 3 equal parts, like that. So if you come to the diagrammatic representation here, so this would be, let's say, 28 weeks. Right? This would be, let's say, 32 weeks, and all the way up to the Ziffy sternum would be 36 weeks, right? Then what happens at term? At term, you see that the head drops down into the pelvis, okay, or whatever the fetal presenting part is, it drops down and enters into the pelvis. So as the head drops down into the pelvis, the fundal height is going to be lesser, fundal height is going to decrease, and there will be fullness in the flanks. So there will be it will be roughly at around 32 weeks level, roughly, okay, this could be 32 weeks level, 34 week level, like that. So roughly at around 32 weeks level and with fullness in the flanks. Okay, so this would be term, fullness in the flanks, like this. So once you have marked the fundal height here, okay, and you documented it in weeks, then one measures the symphysiofundal height in centimeters. Now for that, you'll have to ask the woman to straighten her legs. Okay, in front of the examiner, if they ask you to demonstrate, ask the woman to straighten her legs to measure the symphysiofundal height in centimeters. Let's see, like this, because then it becomes easier to place the tape, okay, the inch tape, onto the pubic symphysis correctly. So you have to ask the woman to straighten her legs, and as you can see in the image here, the inches side is facing you. You are seeing the inches side and the centimeters side is hidden from you. to avoid any bias. Okay, so look at this. So we had marked the fundal height here with the help of a pen. We are measuring the symphysiofundal height in centimeters. Centimeter side is hidden. When you measure it, then you turn it, and when you turn it, you note the symphysiofundal height in centimeters. So this is 1 centimeter was kept here. This is 32 centimeter in this particular situation. So symphysiofundal height is documented in centimeters. Now know what is important here. It is important to document the symphysiofundal height in centimeters beyond 20 weeks because you see, after 20 weeks, we see that the symphysiofundal height in centimeter increases approximately at a rate of about 1 centimeter per week, right? Therefore, between, let's say, 20 to 34 to 36 weeks, between 24 to 34 to 36 weeks, the symphysiofundal height in centimeters is going to correspond to the gestational age in weeks roughly. That means if I measure the symphysiofundal height as 30 centimeters or 32 centimeters or 34 centimeters, it corresponds to the gestational age in weeks. So if I measure it as 30 centimeter, then roughly the gestational age should be 30 weeks, and this has a variability of plus minus 3 centimeters here and there is going to take place, right? Now also remember that it is important that the woman is examined per abdominally after emptying her bladder, because many times in OPDs you will find that patients have been waiting in line for a long duration of time and they come into your OPD with full bladder and then you examine them. Full bladder is going to push the uterus slightly up and you may get a falsely elevated fundal height. So it is good practice to examine the patient's empty bladder after they have passed urine, right? Sometimes you can have a situation where your fundal height is more than the period of gestation, right? Then you think about, first of all, wrong dates. Maybe whatever dating calculation, LMP calculation, POG calculation you had done was wrong. So revisit your menstrual history, revisit your calculation. Okay, wrong dates could be one of the reasons. Maybe wrongly given, maybe wrongly calculated, whatever. So revisit the entire menstrual history and dating history again. Full bladder could be another reason, right? And yes, of course, there could be multiple pregnancy. There could be molar pregnancy, right? In molar pregnancy, if it is a molar pregnancy where you are identifying it, advanced in gestation with a uterus that is 16, 20, 24 weeks in size, then with a complete molar pregnancy, you will not be able to palpate fetal parts, right? So that's an important distinction, right? With multiple pregnancy, especially when you are examining a patient, let's say 24, 26, 28 weeks, when you're examining the patient at advanced gestation, it becomes possible to, palpate multiple fetal parts, right? So you can always gain a lot of information from your initial clinical assessment as well. So keep that in mind. Polyhydramnios, right? That could be another reason. And maybe there is a fibroid uterus, which is also, giving a false sense of increase in fundal height. So maybe there is a fibroid uterus that is responsible. So remember these common causes, and sometimes the fundal height can be less than the period of gestation. Then you think about wrong dates again, right? You think about oligohydramnios, you think about abnormal lie, like for instance, there could be a transverse lie and that's why the fundal height is less. You think about fetal growth restriction, you think about IUD, right? So when you do find a fundal height less than the period of gestation, it is important to revisit the dates. It is important to ask if there is any history of leaking per vaginum, maybe that could be responsible for the oligohydramnios. Something that is very obvious on history itself. It is important to conduct a thorough examination to check if it's a transverse lie. Or let's say to ask about perception of fetal movement, especially when identified later on in pregnancy. Keep that in mind, okay? Somebody who's not perceiving fetal movements at 16 weeks, you will disregard it because it's too soon to perceive fetal movements, isn't it, right? So keep that in mind, right? So all in all, yes, how sensitive is the perabdominal examination to, let's say, pick up fetal growth restriction? If you look at it that ways. I mean, what if you do identify a fundal height that is less than the period of gestation? Then after eliminating all the possible, let's say, after eliminating the possibility of abnormal lie, after eliminating an intrauterine death or wrong dates or oligohydramnios, what is the sensitivity that you're going to pick up fetal growth restriction? So that's an important point to note here, is that the specificity of the abdominal palpation is good. That means if there is an abnormality, you're not going to miss it, right? Remember, basic statistics, specificity is few false positives. That's what specificity means. So the specificity of abdominal palpation is somewhere roughly between 80 to 90%. It's very variable. It also depends upon the clinical expertise as well, but we all gain it with due time.